Also, I'm not about to go around to every person in the world and say, look, it's me. I want to talk to you. So I pick one man, one very good man. I told him, God lives. I live. He had trouble believing too, in the beginning. I understood. I'm not sure how this whole miracle business got started anyway. The idea that anything connected with me has to be a miracle. Personally, I'm sorry that it did. Makes the distance between us even greater. But if a miracle helps you believe that I am who I say I am, I'll give you one. A good one. Let me see. What's my most impressive miracle? Pick a card. Rats. I'm fresh out of card tricks. So how about this one? Pull my finger. You've seen that one before. Tough audience. Anyway, hello boys and girls. It's me again, and perhaps you're thinking that heaven can wait. And with a year of pandemic and missed in-person worship, maybe I can understand that. Absence doesn't always make the heart grow fonder. And even myself, sometimes I thank God for unanswered prayers. But with the popularity of our last series, I decided this time to give it another shot. Another shot. Maybe it's my delivery. I need to work on that. Nobody's perfect. Apparently, not even me. Or is that I? Not even I. Grammatically speaking, perfectly, that is. Anyway, boys and girls, traditionally, when one thinks of an American dream, as we do even where I come from, one considers the possibility that their kids might one day enjoy far better opportunities than they did themselves, and better than even their parents before them. And with nearly 10 months having passed since a good friend of ours, Governor Ralph Northam, a medical doctor, began the vaccines rollout for COVID-19 in the pandemic, and with 77.1% of consenting adults, even without a mandate or a command from God, having been administered at least one shot of the countermeasures that had been released for emergency use in mid-December of 2020. After the election, it was announced by the Virginia pilot that vaccines for Virginia children aged 5 to 11 could be available as soon as the end of October, upon approval of the FDA, of course. And that, in the meantime, our very good friend, a medical doctor, Governor Northam, will be working with local school divisions and health departments to launch vaccine clinics for younger students in school, a strategy some localities have already been using for the children 12 and older. And at least for Arlington Public School Superintendent Francisco Duran, a truly remarkable human being, who had made a decision to close schools even before the governor, being proactive. This means that kids can now enjoy the benefits of safe, in-person instruction, from which they had been deprived for over a year as a consequence of his decision. And he took the opportunity to make a very instructive video, highlighting his stellar achievements as an educator, demonstrating for our visual learners exactly what he meant when he said safe. And we all watched, even myself, with amazement, as he was safely administered the vaccines by a member of the medical staff. And as should be self-evident to anyone watching this truly informative video, Dr. Duran was perfectly safe and free from all harm on camera. And as you should know, boys and girls, this safety requirement was one of the standards that had been used for approval under the emergency use. That is, that more likely than not, the experimental countermeasures would not immediately result in his death. So, no big surprises. And boys and girls, since Dr. Duran was available to stand by the side of our good friend Dr. Northam recently to announce the vaccine rollouts for kids, you can rest assured that more likely than not, you too will not fall into convulsions and die immediately after being administered this safe vaccine. No guarantees, it still may happen, but more likely than not, it won't. and may well feel perfectly fine long after having been administered this safely tested vaccine product. What that has to do with your school being safe during in-person instruction, you would have to ask Dr. Duran, because I am not sure and cannot quite follow his logical process. But nonetheless, I am very confident that as a very learned man with several degrees, he would be more than happy to share his collective and well-considered thoughts with you, even though he is not a licensed medical doctor, which should be quite obvious, boys and girls. In any event, I wish to take this opportunity to bring you up to date on some things that the good Dr. Duran, or even our very good friend Dr. Northam, did not find it appropriate or necessary to share with you when he was promoting vaccines for children between the ages of 5 and 11, who we normally tell just to say no to drugs. And perhaps this information will better educate you to feel confident about your choice to have your child follow you in your pursuit of this American dream of following others, and finally saying goodbye, farewell and adieu to a dreadful pandemic crisis, and return to a life that is normal, perhaps even returning to church. As you know, some vaccines, like the annual flu shot, with which at least some of you should be familiar, boys and girls, are not a part of a sweeping government mandate. We don't force you to take the flu vaccine, even though, as we have been told many, many times in the public health crisis, that vaccines are a tested method for addressing infectious disease. And at least for our more discerning and curious students, some of you may have asked the question as to why. Maybe you've turned to prayer to find that answer. Maybe you've read your Bible. Perhaps you should have read a science book. But that is still a very good question, and quite indicative that you are actually an inquisitive and intelligent person and don't just look like one. But since not everyone is quite as intellectually gifted as you and I, we have a duty to share our knowledge and talents so that others may benefit from the fruits of our knowledge and training, or paying it forward, as the popular saying goes. And I like to be here. And perhaps, boys and girls, the best way to explain why these vaccines are not compulsory or mandated for the flu, it is probably a good idea to review those vaccines that we know have been mandated in environments previously, like public schools for in-person instruction. Let's try a little COVID-19 test, shall we, boys and girls? Can you name one, just one, mandatory vaccine that has been required for matriculation in school before the pandemic? Did you say hepatitis C? Well, that is an excellent choice indeed, and perhaps one day you shall be a fine doctor or even a pharmacist or drug dealer. But while hepatitis A and B are quite common mandatory measures, even with active duty soldiers, they are only required to be administered the hepatitis C vaccines when they are scheduled to deploy to nations where hepatitis has been identified as a public health concern. And the same for malaria. Do you expect to catch malaria in school? Of course not, unless you're in Panama. So why take the perfectly safe medication? It's just common sense, and the facts speak for themselves. Similarly, would you want to volunteer for an anthrax vaccine? That caused quite a bit of litigation in the military some years ago. And while that litigation turned on the failure of the military to obtain proper approvals, which may or may not be a problem now, it is important to note that the United Nations has even stated that anthrax cannot be transmitted from person to person, that it requires a high infectious dose between 8,000 and 50,000 spores. And if there is an incidence of anthrax infections or outbreaks because of the enormous expenditure, lots of money, required to develop weapons-grade anthrax, then someone needs to call Interpol or the CIA or James Bond, because it is more likely than not, kind of like that safety factor, more likely than not something that has been developed in a laboratory with expensive centrifuges and financed by state-sponsored terror. You would think that a terrorist nation would find some cheaper means to conduct bioterrorism after all of these years. But according to official sources, that day has not yet come. Perhaps one day, maybe someone will develop a cheap coronavirus, so we can all feel safe and secure. And hopefully, in the meantime, none of these experimental biological munitions might, accidentally escape. But besides hepatitis C, boys and girls, what other diseases can you think of that require vaccinations to attend in-person instruction in school? How about smallpox? Recently, the Washington Post did a wonderful story that had indicated that General George Washington, who never told a lie, had ordered his troops to be administered the smallpox vaccine because he, being a person of affluence and sufficient means, had been infected with smallpox while vacationing in Barbados as a teenager. Not many colonists had that opportunity, but he did, and considered it a great risk to the nation in 1777. And in this intriguing story by the Washington Post, boys and girls, because as you know, or should know, smallpox is caused by a virus, and they were not discovered until the late 19th century, and smallpox virus was not discovered until 1901, long after General Washington was dead and buried. However, state-of-the-art science at the time, there was still amputating soldiers who later died from infections caused by operations, like General Stonewall Jackson, who died after being operated upon by Army doctors, like Ralph Northam, after he got shot in the arm. What a coincidence. By his own troops, decided that if they had extracted the pus from persons infected with smallpox and inoculated persons with small samples, they might, through a process known as Mithridatism, the technical term for the pirate Wesley in that wonderful movie, The Princess Bride, had done with the iocane powder, they might be able to create some crude type of immunity, at least efficacious, but not necessarily effective because they didn't learn how to do that until starting in around 1870. And the Washington Post reports that Koch's postulates, and the Washington Post reports something we haven't done with COVID-19 for one reason, and the Washington Post reports that, as expected, after receiving the inoculation, soldiers got sick with mild smallpox. But unfortunately, there are no studies on exactly how effective this trial and error method was. Nor would it be wise to speculate on what this crude form of medicine actually did. But it was a good try. And no, not even the Army today will mandate the smallpox vaccine, especially injecting pus in people to see what happens, turning them into a phase 3 clinical trial. So come on, boys and girls, put on our thinking caps and name a mandatory vaccine that you receive every year for attendance at school, besides COVID-19, of course. Did you say measles? Why, that is an excellent choice. And one of my very favorites because, as you know, when I was a child, we still had children in school who had gotten infected with measles, which, for some strange reason, most people think of as a disease that is not a respiratory tract infection. I think they get it by touch or radiation or whatever, but it's actually a respiratory tract infection, small enough to be aerosolized, suspended in the air for many hours. And before 1963, there was as many as 3 to 4 million cases of measles each year in the United States. It somehow never became a pandemic, at least according to our good friends at the CDC. But since the year 2000, that disease has been practically eliminated. But we continue to vaccinate just in case, to be on the safe side. And we certainly wouldn't want to cut off the income of someone making their living on measles vaccines. It would just be cruel, even if they have long outlived their usefulness. But now, let us compare measles with COVID-19. Well, it was not until the arrival of the dreaded Delta variant in the spring that our good friend Dr. Rochelle Walensky had announced that COVID-19 might be as infectious, if not more infectious, than measles and chickenpox, which have a validated secondary attack rate of 90%. They looked at the tracer contacts, and this is what they came up with. What that means, boys and girls, is that if you are infected, 90% of your close tracer contacts, people you come in contact with, will become infected. Just like Typhoid Mary, a notorious carrier during that epidemic. Epidemic is a term we use at the CDC, which means that you have a 6.7% mortality rate. That is your mortality over your population, not your infected, which COVID-19 has yet to achieve. at any time, in any place. Of course, because nobody considered the Delta variant a problem back in December, but at least we can say, at least according to our good friend Dr. Walensky, COVID-19 is just as infectious, if not more so, than measles, even with no proof. Kind of like fate. Can you catch measles at an outdoor event? In 1995, believe it or not, according to NIH, 16 persons contracted measles while attending the Special Olympics in Minneapolis, St. Paul, an outdoor event. Yeah. In fact, can you catch H1N1 outdoors? The Spanish flu. During the Spanish flu pandemic of 1918, over 1,000 people had died in Philadelphia after participating in the Liberty Loan Parade. And these were considered highly contagious diseases, which kind of makes sense because you need a highly contagious disease to set off a super spreader event, or a low infectious dose, which probably means you have a highly infectious disease. But for some reason, we have not found any similar outdoor risks associated with COVID-19, a slight anomaly. And after reviewing almost 56,000 laboratory-confirmed cases in China, from over 75,000 reported before February 20th, 2020, they found absolutely no outbreaks associated with large social gatherings. So why we locked down, I am not quite certain. But the science continues to evolve on COVID-19. So it may be highly contagious, according to the CDC and other medical professionals, and over 90% infectious, as they say, even if we have no numbers to actually establish that. So we can put a little question mark here on highly contagious, like measles for now, in terms of vaccinations, because that jury is still out, and that is debatable. And it, in fact, is subject of about 4 cases in state federal courts. So how about hospitalization, boys and girls? Nobody wants to go to the hospital. Well, according to the CDC, before 1963, when mandatory vaccinations began to reverse the tide of measles infections in the United States, 1 in 4 cases would result in hospitalization, or a 25% case hospitalization rate. It's not fatality rate. MERS has a 39% case fatality rate. 39% of the people that get it die. But this is just 39% of those who are infected go to the hospital. And many have elected to take the vaccines to avoid having to go to the hospital in the event that they actually got a disease that only 8% of Virginians have gotten. And we're not quite sure if some of those are repeat offenders. That's still out with the jury, where probability of succumbing to this disease have been considered greater. So if we were to compare the probability of hospitalization for measles with COVID-19, what would we find? For comparison, well, in Virginia, the case hospitalization rate is actually 4.3%, or 5 times lower than measles. And this is down by 10 points from last year at this time, when the chances were at about 14%, or about the chance that you might be even slightly injured in a parachute accident if you're into jumping out of airplanes. Why hospitals only now are reporting to be exceeding capacity with a lower hospitalization rate for COVID-19 infection? We can only assume that perhaps maybe the influx of refugees from Afghanistan that felt like Saigon is not related at all to any of this. But again, to be on the safe side, since that is debatable, let's just place another question mark next to that for undecided, boys and girls. Continuing on the American dream, based upon earlier studies comparing hospitalization rates for those who are vaccinated with persons who are unvaccinated, using studies that had been prepared by the CDC, medical professionals examining hospital workers and first responders, who they claimed were on the front lines, even though hospital settings related infections and outbreaks like those in the Richmond public schools in the United States have been practically non-existent. But let's just review that data rather than just use wholly unconventional conclusory statements, trying to sell something not based upon any empirical evidence, but hoping on your faith. Shall we, boys and girls? According to the CDC in April, if you take only 1 dose and are partially vaccinated, you enjoy an 80% vaccine effectiveness against being infected. Those are the CDC figures, not mine. I'm not making that up, not pulling that out of a hat. If you press on to get the second shot for full protection, you will enjoy a 90% vaccine effectiveness against infection. In this study, they were only talking about the Pfizer and the Moderna 2-shot regimens, and a lot of questions are being raised about the effectiveness of the Johnson & Johnson 1-shot adenovirus-based vaccine, akin to the AstraZeneca product being distributed in Europe. And if you were a reasonable person, boys and girls, you would expect the unvaccinated person to be far below 80% the protection enjoyed by the person who had been administered only 1 shot. Like right now, 70% of Americans. And this was a study of almost 4,000 public health care workers and first responders claimed to be on the front lines of the fight against COVID-19. And at least when I divide the 161 unvaccinated persons in that study who got infected by the total of, 986 unvaccinated persons who participated in the study, I arrived at an infection rate of 16%, which we can convert into an unvaccinated vaccine effectiveness rate by simply taking 100% minus 16% to infection, which is like 84%. How can an unvaccinated person have a higher vaccine effectiveness than a person who took the first shot? You'll have to ask the CDC because I cannot follow their logical process on that. So again, let's just be on the safe side and place a question mark next to that for undecided in our pursuit of the American dream. Nonetheless, UVA's Dr. William Petrie, a real MD, the chair professor of infectious diseases and international health, very impressive title, at the University of Virginia, said that he believed that getting the vaccine is the single most important protective thing you can do. And if you get impressed by titles and you don't need to know anything more, that's a very, very good thing to know. But inquisitive people may ask some more questions. But it is his belief that the risk is really among unvaccinated individuals. And to back these claims, he provided for you and I some numbers, which is always a good thing because it gives a businessman or just a reasonable person an opportunity to compare apples to apples and apples to oranges. And according to Dr. Petrie, medical doctor at UVA, data he had examined from England, not even in the United States, and in an unpublished study, so it hasn't been approved yet, kind of like the report that they used to approve the FDA vaccines for Pfizer, which means that the findings in this report had not yet been approved for release. But he was, nonetheless, providing an early leak about what he believed to be good inside information. Whether it was or not, we have to wait to see what grade the unapproved report gets. The mRNA vaccines made by Pfizer and Moderna appear to protect quite well, appear, he says, against the Delta variant and particularly against hospitalization, because that data showed that the Pfizer vaccine was 94% protective against hospitalization. But the AstraZeneca vaccine, which is an adenovirus-based vaccine similar to the Johnson & Johnson vaccine, as we said, was about 92% protective against hospitalization. Again, great numbers to get the customer saying yes, 92% effective against hospitalization for Johnson & Johnson shot, the 1 shot, and 94% for the Pfizer and Moderna. And you look like an intelligent person, so which one would you choose, 92% or 94%? You go with 94% because that sounds like it's a better grade. Moderna, Pfizer, wonderful, 94%. Well, any reasonable person, boys and girls, would want to inquire about what options appear off the menu, like, for instance, the success of being unvaccinated. Why get a shot if you don't need one? Why take on the risks associated with vaccines if you don't have to? This way you don't even have to look to find out, how many people might have gotten adverse events or perhaps died, gone to heaven or the other place. And if you run the numbers like we did, boys and girls, and I'm going to tell you how to perform these calculations for free because I don't want to take up a collection right now. And you look like you need to be able to do this as an intelligent person yourself. teach a man to fish, he'll fish for life. What we do is we take the total number of hospitalizations in Virginia, which is 30,706 on the day that we examined, from a total of 681,890 cases of infection associated with 11,441 fatalities, which translated at that time into a case fatality rate of 1.67%. Taking the number of fatalities and dividing by the number of infections, a hospitalization rate, we arrived at a hospital fatality rate of 37.25%, which is quite high if you have to go to the hospital. Quite high, but it's actually lower than it was a year ago when it was about 44%. Taking the numbers of fatalities and dividing by the number of hospitalizations and a hospitalization rate, we arrive at of 4.5%. Taking the number of hospitalizations and dividing by the number of infections, and if you convert that number, you arrive at an unvaccinated, did you follow all that? You arrive at an unvaccinated effectiveness rate against hospitalization of 93.5%. You can just play back the video and figure out how we got there. 93.5%, compared with what Dr. Petri at UVA says is 92% for one shot, Johnson & Johnson, and 94% for the two-shot regimen, which is not really very much different at all from 93.5%. That's like a 0.5% against an infection that has a 1.7% chance of actually killing it. So for now, let's just put another little question mark next to these findings in our pursuit of the American dream for undecided. Did you know that you have a 1.3% chance of becoming a fatality in an automobile accident compared with 1.7% of being a fatality from COVID-19? It's kind of interesting. So I guess the bottom line is that if you want to provide an American dream for your kids, a responsible adult would want to do the homework and resolve some of these questions, and perhaps develop a list of your own questions as well. Because remember, boys and girls, the only stupid question is the one that you fail to ask. Like, is there a heaven? And can I go to hell? And someone may actually have the same question, but is afraid to ask. But in a deadly public health crisis, at least where I come from, we believe it is better to ask the question while you can, so you don't have to kick yourself in the butt for not asking the question before you wound up in a hospital or at St. Peter's Gate. That was informative, at least for me. But that is all we have time for right now, boys and girls. And I hope sincerely that this familiarization has assisted you in better understanding the meaning of life, the concepts of infection, and disease prevention. Thanks so much for joining us, and see you next time. Or not. And just remember in November to keep Mike Webb away from our schools. This briefing is unclassified. So help me.
This advertisement was authorized by Mike Webb.
Thunk, I could have had a vaccine.
Say goodnight, Gracie.